right, ready? Take a deep breath. Deep breath. Come on, Jordan. Deep breath. Hold it, bear down on it, and cough. Then what you want is your thumbs to kind of just rest slightly, so that the movements of your fingers would be anchored into the chest, not dug into it, but just anchored there. But then you're watching the separation or the symmetry of their breathing. So essentially, you want the thumbs to be moving together when they move the chest. So we're going to do it the bottom part here. Okay, again, we're on the sides here, anchored in, and then take a deep breath. And then out. So let's say if he had some kind of atelectasis or some infection or whatever it might be on this side, we might see something like this. Okay, take a deep breath. If I play it out. Okay, and blow down. See the difference? Like one thumb isn't moving. So we should see much more expansion of the lower part than the upper part. If we're seeing just the opposite, then we know the diaphragm is either weak or it's really kind of stretched out and it can't really work. So when we look at things like emphysema, you see those barrel chests where the diaphragm is so stretched out, the lungs are trying to pull it back in, but the whole thing is just stretched out. The lungs have lost their ability to bring things in, and so that as a result, the domes of the diaphragm get flattened out and the chest starts to broaden down. So we'll see a comparison between the upper and the lower. So if we come down here, and take a deep breath, and back out again. You can see that? You see that, again, the symmetry is what you're looking for. The other thing you want to do is start to do your auscultation. So since he's facing this way, we'll start in the back. You can do it anywhere you want. You can do it here or here, whatever you want, but you want to do it the same place on the right side and the same place on the left side. Okay, so that's what you want to do. You want to compare one side to the other. All right, so you want at least 3 spots on the back, at least. 4 would be better, but 3 in the back on one side, the other. And then you want one on the sides. All right, so 1, 2, 3, 4 on the sides. Sorry, Dave. We're looking at the upper chest here, so again we want symmetry. Okay, symmetry, and again down here on the sides. Okay. Out here, we're going to hear vesicular sounds. Over here, we're going to hear more bronchial sounds, broncho-vesicular sounds. And then right over the trach, you'll actually hear more of the bronchial-tracheal sounds. So out here, you'll hear more air going in on inspiration, and then hardly anything on expiration. Over here, you hear a little bit of a mix, and then over here, you hear more on the out part, expiration, than you do inspiration. The big thing is that when we're listening one side to the other, we can pick up where the lungs are not ventilating well. So if that's the case, we can identify which lobe, and then we can figure out what position to put them in and things like that.